Hi everyone, Assalamu alaikum. This is Dr. Tazeen here from StudyMEDIC, and we are here with another session of YouTube series in which we are going to discuss a patient-simulated task about preconceptional counseling for epilepsy. These patient-simulated tasks about the counseling stations are very, very important as far as MRCPI exam is concerned, and we are here with free YouTube series. If you have not subscribed the YouTube channel of StudyMEDIC, subscribe now and just click on the bell icon so that you can stay updated with our upcoming series of various sessions. So here we have a case which we are going to discuss, and let's see that how we have to perform in the exam. We have examiner with us, Dr. Soumya, who will evaluate and then she will give the feedback to us. Hi, Dr. Soumya.
Hi, Tazeen. Thank you so much.
Hi. So we have our role player with us, Monica, and then we will start the simulation. So let's start. Can we start, Dr. Soumya and Monica?
Yeah, sure.
Yeah. Just 1 minute. So before start of session, I always say just one thing, that keep your passion and dedication alive and everything will come on your way. And every hustle, every hard times which you are having, that is actually the antidote to your problems. And definitely one day you will be successful and you will be able to achieve your goals. But the key ingredient of success is always passion and dedication. So with this passion and dedication, let's start today's simulation and let's see what we have to do. Hello, this is Dr. Tazeen, one of the doctors in the preconceptional clinic. Am I talking to Monica Jones?
Yes, doctor. This is Monica Jones.
Can I confirm your age?
I'm 24.
All right, thank you. Monica, I can see that you are having epilepsy and you are planning your second pregnancy, and you are here to discuss that whether it is right time to embark on pregnancy. Is that correct?
That's right. Yeah, that's right.
Apart from this, do you have any other concerns or expectations, Monica?
No, nothing.
All right. So, Monica, would that be okay if I ask you a few questions to know more about you? I will address all your concerns, will involve my consultant in your management plan, will provide you the patient information leaflet to know more about you, and will write back to your GP as well. Would that be okay, Monica?
Yes, that will be great. Thank you so much.
All right. So, Monica, can you please tell me more about this condition, epilepsy, since how long you are having this problem?
I have it since my childhood, maybe like 6, 7 years old. I had it.
I'm so sorry to hear that, Monica. And are you following up with your doctor for the control or for the medications?
Yeah, I was, but last like 1.5 years, I was not, it's not doing.
All right. Is there any specific concern that you are not going to your GP or doctor?
No, I was kind of busy with my life and I was, I didn't get a proper time. I'm handling the babies. So
exactly. I can understand that.
Yeah.
So can you please tell me when was your last fit?
3 months back. 3 months back I had.
All right. And did you need any hospital admission at that time?
No.
All right. And how many fits you had in the last year?
How many, sorry?
Seizures or fits you had in the last year?
Last year, right? I had three times.
All right. Are you taking medicines for the epilepsy, Monica?
I am. I'm taking. I'm on medication.
Are you aware of the names?
Yeah, valproate is one of them.
All right, all right. And can you please tell me about your previous pregnancy? How was the pregnancy?
Yeah, it was like 6 years back. My baby's like 5 years old. All went good. During the time of labor, I had a seizure. And when she was born, she had this, cliff lip, and she had that facial deformation was there. So I'm doctor, to be very honest, I'm a little concerned because I'm planning for my second delivery and I want to get pregnant, and I'm just so alarmed about the previous one what I had. So I want to make sure that this time everything goes better. And
I can understand, Monica. I can understand, and I acknowledge your concerns, and we are here to support you. Are you taking folic acid, Monica?
I haven't, no. Before, yes, during the time of pregnancy, yes, but not now.
All right, all right. Is there any medical concern apart from epilepsy you are following up with your GP?
No, no other medical
Any
concern.
allergies?
No,
Any surgeries in the past?
no surgeries.
Any family history of concern?
No, not of my awareness.
Don't mind me asking, do you smoke or drink alcohol?
Occasionally, yeah,
Have you
not
ever
regular
thought of
smoke.
quitting?
Not planned, maybe
All right,
in the future.
all right. Okay, I will discuss that with you.
Yeah.
Do you take any recreational drugs, Monica?
No.
And are you aware of your height to weight ratio?
Yeah, it's normal. Yeah.
All right. And whom do you live with, Monica?
Yeah, I live with my husband and have my baby Zara. We live together. Yeah.
And how is the support at home?
Yeah, they're very supportive. I have a long, wonderful family.
That's really good to know. Is
Hello.
Is there any family history of concern, Monica, you want to share with me?
No, we don't have any family history.
All right, all right. Okay, thank you so much for the information, Monica. So for now, just summarizing that you are 24 years of age and you are planning your second pregnancy, and you have epilepsy for which you are taking sodium valproate, and you are here to discuss the preconceptional plan. You have not started folic acid yet. Anything else you want to add?
Yeah, just concerned about, born a baby, and the first one was little bit terrific. I had it during the time, I had seizures during the time of labor. It was really hard, and even the baby, now she's okay. We did the operation, everything is fine, but just wondering whether it's going to repeat for the second one also.
Yes, I will address all these concerns, Monica. First of all, I really appreciate that you are here to discuss your preconceptional plan, and you are so much concerned. That shows that you are going to be an excellent mom. I want to reassure you that most of the women with epilepsy, they have straightforward pregnancies and they have successful pregnancy outcomes if they are in close liaison with their doctor or the physician, and if their epilepsy is controlled, and if the medicines are being reviewed. Are you with me, Monica?
Yeah, I am. I'm
So,
listening.
Monica, if the epilepsy is not controlled, it can have certain effects on the baby as well as on the mom. First of all, if you are taking some medications which are not baby friendly, then it might have some effects on the baby, like they can have, which we call as neural tube defects. They can have some problems with the spine. They can have some problems on the face, as well as some cardiac problems or heart problems can also be there. And also, Monica, if you are not taking care of yourself, and there are certain triggers of epilepsy which can increase the risk of having fits, like you are tired, you are sleep deprived, or there are some thing which is you are stressed, so this can add up to having fits. So all these things we have to take care. What I will advise you, Monica, now is that I'm starting folic acid 5 milligram for now, and you should start taking it and continue the contraception. Can you please tell me, are you practicing any contraception or not?
Yeah, we use condoms.
All right. So condoms are good. They can protect you from the sexually shared infections, but at the same time, they are not very success. There can be slight failure rate with the condoms. And till you are planning pregnancy and your neurophysician is giving you the go ahead to start on pregnancy, you should continue some effective contraception. So, Monica, I will advise you and I will fix an appointment with your physician so that few drugs, the sodium valproate, which you are not taking, it can be slightly associated with the risk to the babies, like having facial defects. And as you told that your previous baby is also affected, there can be slightly increased risk that the next baby can have the problem. So we need to optimize and we need to change this medication, Monica. Okay. All right. So, Monica,
Yeah.
once you miss your period or you get pregnant, you have to report to us as early as possible. We will do the early pregnancy scan. We will do the Down syndrome screening and also the mid-pregnancy scan to see that the baby, how the baby is growing and everything is fine, and to rule out any congenital defects in the baby. Your care would be by a team of doctors involving your neurophysician, my consultant, and epilepsy specialized nurse. We may need to do some more frequent scans to check the growth of the baby. We will assess you for any other coexisting medical disorders like low blood, which we call as low hemoglobin, increased blood pressure. We will screen you for the diabetes. And I want to tell you, Monica, that once you are near term or the epilepsy is not an indication that we have to go for cesarean section, and we can go for normal birth as well. Are you with me, Monica? Do you have any questions?
I am. Yes, I'm listening.
All right. So, Monica, during labor also your care would be by a team of doctors, which we call as multidisciplinary team, involving my consultants, sleep doctor, baby doctor, specialized nurse. We will keep you warm, pain-free. We will continuously monitor your baby's heartbeat, and as well as we will monitor your observations as well. And if there is no concern that baby's heartbeat is dropping down or if any concern, we may go for vaginal delivery. After delivery also, we will monitor you for pain, bleeding. We will support you in breastfeeding. We will guide you how to take care of the baby. We will keep you pain-free and warm so that there are no triggers for the epilepsy as well. Are you with me, Monica? Do you have any questions?
I am. So you mean to say that the first, it is going to be worse in my second, more than the first? Maybe the chances of getting defects and, problems, issues with the baby is more compared to the first one, right?
Your concerns are totally understandable, Monica, but those women who are following up and having good compliance with the medicines, following up with the doctor, and they are under good control, then there is no deterioration. 2/3 of the women, they stay, they develop no deterioration of epilepsy during pregnancy. So all these other factors we have to optimize, then there can be no added risks that this can be the more worsened situation as compared to previous pregnancy.
Yeah.
All right,
my
Monica?
concern is not about the well-being, what I'm going to get. It's all about the baby. I just want the baby to be safe and,
yes,
I
yes,
get
Monica,
a healthy baby.
As we discussed earlier, that if you are keeping compliance with the medicine, if your medicines are changed to baby-friendly medicines, like we change sodium valproate to baby-friendly medicine, and you are taking folic acid higher dose as compared to, as we discussed, that I will advise you 5 milligram folic acid, then there are less risks for the baby.
I should have come to you for my first delivery also.
Thank you so much, Monica. So for now, I'm providing you the patient information leaflet. You can go through it and you will get better idea.
Yeah.
I'm writing back to your GP involving my consultant and also fixing your appointment with your physician as well. Thank you so much for coming, Monica.
Thank you, Dr. Tazeen. Thank you so much.
Are we done with 10 minutes or did you finish earlier, Tazeen? You're muted.
9 minutes and 30 seconds as I was in shooter speed.
Okay, fine. I would say very well done, Station. Like your systematic approach was what I liked. Starting from introduction, you checked the name, you started off with the open-ended question about epilepsy. You checked all those 5 checklists: when, where, how, why it was controlled, and the medication she was on. Previous pregnancy also you asked, and whether she's on folic acid, allergies, family history, habits, all that covered. Support was also covered. Probably what I was little bit thing is, when she said that the baby had anomalies, probably a bit of an empathy. I'm so sorry. How is the baby doing? That is something which was probably could have been appropriate.
Exactly.
And you summarized also, and probably a bit about mental health. Even I always forget about the mental health. That is something. And in the counseling part, it was really well done, like starting from multidisciplinary team to starting off the folic acid and first and second and the third trimester in the labor as well as the postpartum. And the only thing is probably because she had seizures during her last labor, you could have mentioned that this time we would be making sure that the medications we will be monitoring. The same thing, you could have emphasized that. Other than that, I think the GP letter you said in the fixing the agenda and repeated again because you had time. So I think otherwise it was well done. And also one thing about contraception, just to show off your knowledge, you could say, because valproate, you can choose anything, any long-term contraception or anything, like pills could be given. So the examiner would know that you are well aware of the contraception.
Exactly. Actually, I was thinking about that. Then I thought that this is preconceptional. She's planning pregnancy. So I'm going to contraception. So
no, but also the one thing which you mentioned was that it has to be giving a green signal from the epilepsy specialist. That is when you can pitch in saying, till then use a stable contraception or effective contraception.
Exactly.
Otherwise, I think it was well done. Thank you.
Okay. Thank you so much, Meera. Thank you. So how you feel, Meera, as a patient?
Ma'am, the language was very simple. You didn't use a lot of clinical terminology. So it was very simple, easy to understand. First, when you said there are a lot of anomalies for the babies that might happen, like spine and cardiac and all those things, which actually raised a concern in me, like whether I'm going to get a baby. I had a second thought in my mother whether I should go for a pregnancy also. But later on, you covered that when I asked you the question. I mean, you actually said that with the medicines and proper care, that can be actually be controlled and we can get a safe delivery, even though there might be some anomalies, that's clear. So yes, I think you have given me the confidence to have a second pregnancy. So it was okay.
So much. Okay.
It's good, not okay. It's really.
So would you come to my clinic again?
Yeah, I will.
Okay.
I will sure. Thank you.
Okay. Thank you so much. Thank you so much, Dr. Soumya. Thank you so much.